to our September 20th meeting. Hard to believe that we just went right through summer and it's fall. So we're going to go ahead and kick off. It's a 2-hour meeting today, and so our time is a bit short. I'm going to go ahead and just do a quick roll call, and just please say here when I call you. It's because it's a little hard for me to flip through all the screens and notice everybody. So we're going to start with Dawn Alexander.
Here. Good morning.
Good morning, Dawn. Thank you. Yolanda.
Here.
Hi, Yolanda. Kevin Bishop.
Here.
Hello, sir. Carlos Castillo. All right. Ashley Chase.
This is Sherry Dams. I'm covering for Ashley today.
Thank you, Sherry. Good to see you. Jill Cohen.
Hi, good morning.
Hi, Jill. Good to see you. Michelle Dossey.
Thank.
With your beautiful background, I still want to replicate that in my house one day. All right, Tara. Not seeing her. Ida.
Here.
Hi, Ida.
Hi.
Jennifer Isle. Leanna.
Here.
Thank you. Zane.
Zane is here. Thank you.
Hello, Zane.
Good morning.
Nate Halpern. Adriana.
Good morning here.
Hi, thank you. Lori.
I'm here.
Thank you. Shayna. Tess. Let's see, Gina Lopez.
Hi, I'm here.
Okay, hi, Gina. Chris Menz, did we just see a note from her?
I'm here.
Ah, there you are. Hi, Chris. Michelle Murphy, we just heard from. Gotcha, Michelle. Margaret. Margaret Ochoa. Colleen. Sarah.
Here.
Hi, Sarah. Rashawn.
I'm here. Good morning.
Thank you. Good morning. Nicci.
I'm here.
Hi, Nicci. We know you're here, right? You're the star of our show today, one of our stars. Kathy Wells, hello. We know you're here.
Morning.
Donna, we know you're here because you have bragging rights to the best concert of the season. Kelsey, actually, do we have Kelsey Wirtz? I'm not sure if we have her or Heather subbing in today. I see neither. Jade. Okay, and Timothy Smelser. All right, I think that's it. Fantastic. Moving on to some quick business here. I will assume all of you had an opportunity to go into the link, the Google Drive, and pull down today's materials. You should find your agenda in there. And secondly, you should find your meeting minutes, excuse me, from meeting 6, which is August 2nd of 2023. Are there any additions, deletions, corrections to that document?
Stephanie, I joined a couple minutes late, but I didn't hear my roll call. Jessica Daughter, I'm here.
Thanks, Jessica. Appreciate it.
Good morning.
Good morning. All right, I'm looking through my screens. I'm not seeing anybody who have any changes to the meeting minutes. If somebody would please make a motion to pass the meeting minutes and announce your name when you do so, and then a second, also announcing your name when you do so.
Hi, this is Tara Dockstader. I'm going to motion to pass the minutes.
Thank
Hi,
you.
this is Michelle Dossey, and I'll second that motion.
Thank you both. Is there anybody opposed to not to the passage of these minutes? Excuse me. Okay, those meeting minutes will pass. Also, in your packet is what we call the August 2nd, 23 meeting recap. As all of you know, once again, that is a fuller summary of the meeting, its contents, and a more detailed discussion of the issues that were presented to the group. It's designed to be part of what will go into our final report or our interim report. That differs from the meeting minutes, as you know, which are a much more outline form. The idea is that we want to write this report as we go so that we as members can consistently review for accuracy the content before a final report goes out. So having said that, everybody should have a copy of this. Are there any sort of changes or corrections that members would like to this meeting recap? Okay, I see none. Trace, I'm not sure we need a formal vote on that unless you would like one.
Let's do a vote on that because we have with some other ones. Yep.
Perfect. All right. Seeing no changes to the meeting recap, again, if I could have a motion to approve this document and a second, and please announce your name as you do.
This is Kathy. I'll make the motion.
Thank you.
This is Zane Grant. I second.
Thank you, Zane. Is there anybody who is opposed to the approval of the August 2nd, 23 meeting recap? Okay, not seeing any. We'll go ahead and move that into our report. Thank you. And it's your turn, my friend Trace.
All right, I'll step in. Stephanie named that I'm looking like an angel this morning with my side lights. So I keep trying to miss it, but it keeps coming back. So apologies. Good morning, everyone. It's been a while since we've seen each other. So excited to be here. We've got a lot of conversation to get into. Essentially, we have two, if you think about it, we have two panels. I'm not sure is someone raising their hand? Okay, never mind. We have one half that's presentation and the other side that's a member panel. We're diving back in again today around, is around the directive of is mandatory reporting effective in surveying children and families in Colorado. I think we've had a lot of robust conversations with members and outside folks around folks that make the calls, and now we are pivoting into folks that receive the calls. I'm personally very excited for this conversation today. If you did your homework around reading the summary reports of the surveys for the folks that are talking today, there's just a lot of different perspectives to get through. And so some that I see in direct, not tension, but direct, differences between the folks we've already heard from, and then also some amongst one another in the conversation today. So I'm really hoping to pull out some of those different perspectives and make sure that we're really hearing and understanding from folks kind of across the spectrum there. So we're going to start with some presentations, actually not on the member side, but big shout out to Yolanda and a number of folks who helped us get in touch with county folks across the state to come in and really talk to us on the systems side. And so I'm excited. I'm going to kind of read names and then I'll bring you up. But we've got two folks from different counties, and we have two folks from the Hotline County Connection Center. So we have Hope from Mesa County, Carrie from Arapahoe, Ron from the Hotline County Connection Center, and Anthony from the Hotline County Connection Center.
Trace,
yeah, go ahead.
I apologize for interrupting. This is Laura. Anthony's ill, so I'm actually taking over his spot for H3C.
Okay. Thank you, Laura. Appreciate you letting me know. So Laura, what is your Hobden? Okay, cool. So I'll put you in here. So Laura and Ron, we're going to have y'all go second. We're going to hear from the counties first. And if I don't see, we've got about 10 minutes for each county and then about 15 minutes collective for the Hotline County Connection Center, which I know is called the HCCC, but we're gonna keep it full name for now. So Hope, are you out there? Are you ready to roll?
Absolutely.
Okay, cool. And are you comfortable sharing your own slides, or would you like for Jordan to pull those up?
If Jordan wouldn't mind, I would appreciate that.
Okay, cool. Jordan, if you wouldn't mind bringing those up. But Hope, would love for you to introduce yourself, and then we've got about 10 minutes to really listen and learn from you. So thanks for being here.
Well, thank you very much for inviting me. I'm very excited to be here. My name is Hope Pfalzgraff. I am what we call a specialized assessment and outreach worker in Mesa County. And we are a pretty unique little team, but it functions very well for our community out here in Mesa County. Specialized assessment and outreach has 4 main tasks that they perform for Mesa County Child Welfare. And of course, I'll be highlighting the hotline that we and the reports that we take, but we do have some other experience that plays into the hotline calls that we take. So we are investigating workers or assessing workers, as we call them in Mesa County. We handle investigations for the egregious, near fatal, and fatal cases of child abuse in Mesa County, as well as all of the head trauma cases. With that particular job task comes a lot of additional training, specifically in death investigation, investigative interviewing, forensic medical terms, things like that, that we really pull from in a lot of areas of our job. We also investigate institutionals, so anything that is happening within a licensed facility like foster homes, kinship care, the Department of Youth Services out here, after school programs, things like that. We also do a lot of outreach in the community. So we will go out, we will educate mandatory reporters on child abuse, how to report child abuse, what happens after they make that call. We also make trainings and we go to events for the public at large, not just mandatory reporters. So they are able to understand what we do. I usually make the joke that the Lord may work in mysterious ways, but child welfare shouldn't. So we do a lot of outreach out in our community so that they know what we're doing, what we offer for families, what services we do provide, what preventative services are out there if we are not the best solution for a family, and also really connecting with our mandatory reporters where they are, understanding the things that they see in their communities, the things that they're seeing with their clients, depending on their role. And all of those things filter into the main job task that we have, which is our hotline calls and child abuse reports. So we utilize all of our assessment skills for every call or report that we receive. This can be from mandatory reporters, obviously, which is what we're focusing on, but it can be from anyone who has a concern for a child. And it isn't always reports that we get to our hotline. Sometimes people are calling and asking general questions. Sometimes people want clarification on certain laws or criteria, and we are that resource for them. And every time we get that call, we treat it like it is an investigative interview. So it's usually very conversational. And we really ask those in-depth, detailed questions. Something that I've learned through my assessment experience is that people aren't usually keeping information back because they don't want to share it. It's because they don't think of it. And people almost always miss something the first time because they're very focused on something that they're very concerned about for a family. And they might not be thinking of all of the other things that might be playing into that family situation. So it's my job on the hotline to pull out those details, really understand what's going on for this family, for the children involved, to know what's going well for that family, and maybe additional concerns that the caller didn't think of. It's helpful for me to know as well through the outreach and education and my assessment experience who's calling in and what information they might have. If I have a speech pathologist call in, the first thing I already know is that that child that we're talking about might have a speech delay, which might increase their risk because they might not be able to communicate what's going on in their home. And I'm going to have to really rely on what that caller has observed and what they have seen. So really pulling and playing to that caller's strengths of knowing how they're interacting with this family and also knowing inherently what risks might be involved with that family based on the mandatory reporter that's calling in. Also, mandatory reporters, they are experts in their field. Teachers, they are experts in that child's education. They see that child the most, but they might not be experts in domestic violence or substance use or neglect that might be occurring. We are the experts on the hotline and being able to pull that information forward, playing to that caller's strengths. I can think of a specific call that we had. It was a school staff had called in. She was very worried for this child's hygiene and just he was talking about being hungry in his home. And that was the focus of her call. And she mentioned that he was beginning to act out a lot in class. So I was able to ask some in-depth questions of what does acting out mean? What does that look like for this child? How is he acting differently? And she was talking about how this child was beginning to have very violent play with his classmates that he hadn't had before, including attempting to strangle one of his classmates. With my assessment experience, I know that that is a warning sign of this child potentially being exposed to domestic violence. So I asked, has anything changed in the family dynamics in the last few weeks or last few months? And she mentioned that a partner had recently left the home of this family. There was a breakup in the family. She hadn't brought that forward before. I asked if she knew anything more about that, and she didn't. She hadn't asked questions. So I asked if she had seen any changes in the mother's behavior, and she had mentioned that mom had had some odd injuries on her cheek around the period of time this happened, but she hadn't asked any other questions. So being able to use those analyzing skills, being able to use those investigative skills, I was able to pull forward that there might be a concern of domestic violence in this family as well, in addition to some hygiene and some food insecurity. So it's just being able to use all of that and really play to our callers' strengths, as I said, and understand that they might not recognize what they're seeing, but they have that information, and they are just wealth of information for us to be able to come together for our families.
Thanks, Hope. Are you wrapping up right there? I just want to make sure.
Yes, I mean, I can certainly go more in depth with these different areas as well, but I did want to respect our time today.
No, I appreciate it. I just wanted to make sure I wasn't cutting you off. Okay.
No, absolutely.
So Hope, I really appreciate that the layout sort of on the system side. I want to say to the task force, what we're envisioning is that we're going to go through all the systems piece. So county, the HCCC, and then we're going to talk to the panel, and then we're going to open it up more for discussion, and folks are staying for that entire time. So just for purposes of time, let's move on to the next presenter, and then we'll kind of come back for questions. So if you have questions or you want to dig a little deeper, just put a pin or a note in that for yourself, and then we'll come back to that. Thanks, Hope. I really appreciate that. I'm going to move on to Carrie. Are you out there? There you are, Carrie. Carrie, I can't hear you. You might have to change your speaker next to the mute button, or select a different microphone. All right, we'll come back to Carrie. Let's move on. Oh, there we go. Carrie.
There we go.
Okay, perfect.
Yep. All right, let me just. Lovely computer issues, huh?
No, you're good. You're good. Carrie, if you could go ahead and introduce yourself.
Sure.
Would love to hear about what's going on in Arapahoe. If you could talk to us through the systems and what's working for you all there.
Yeah, absolutely. So my name is Carrie Gillit. I am the Community Services Administrator, and I've been at Arapahoe County for approximately 18 years. 13 years of that has been really dedicated to Hotline, and I've kind of been in multiple roles. I was a hotline worker, I was a supervisor for 9 years, and now I have the pleasure of being the administrator over the program. And so let me see if I could share my slide deck.
Perfect, we can see it.
Awesome. Okay. All right, so just want to give you a little particulars about Arapahoe County, because each county is unique in how we run our hotline, even though we do have state standards and guidelines. And so Arapahoe County, we're unique in that we actually have a dual hotline system. So we not only take child protection reports, we also take adult protection reports. So we really value having that one number for our community to call to be able to achieve both of the adult and child protection needs. And it also gives our hotline staff the kind of global, or what we call 2-gen perspective of working with families from birth to death. We have kind of unique hours as well. So we have hotline staff logged in and available from 7 a.m. to midnight every single day outside of county holidays. And then after hours, so from 12 a.m. to 7 a.m., our sheriff's dispatch actually receive our calls and communicate with our on-call staff. Our hotline staff, we have an expectation that they have to be degreed staff. So typically the staff on our hotline are brand new in the field. They have bachelor's degrees with oftentimes no experience. And this is really their first opportunity or their first job. And it gives them a really good front door perspective of the work. And it gives them kind of a more global view of it. We are working to actually go 24/7. Our volume, which I have in a few slides, is just growing exponentially. And so we're working to have somebody available 24/7, a hotline staff available. Kind of like I talked about in our earlier was we have our after hours program. And so we contract with our daytime staff. There's roughly 21 staff who rotate around, and they also receive calls after hours and then do our responses should we need any immediate responses. We really value oral reporting in Arapahoe County, which I think is fairly consistent with the metro area as well. We can take online like police reports, or if we get an email to our department, we certainly can absorb that and input it that way. But we really pride and coach our reporting parties to do oral reporting. Much like Hope had described, we want more information. We want to make sure that the information we have will give us the ability to make good decisions on whether or not we have to intervene with a family. And having the ability to provide that oral reporting, it gives us the opportunity to ask clarifying questions, to try and whittle through those very gray or blanket statements, to question if there is a bias or what's presenting as a bias, to ask some more questions about that. And then we also follow through with the enhanced screening tool that is provided by the state. And because we have certain specialties in our county, so we have a military base on our county, we also add in our own questions with enhanced screening, just so that we can make sure that we're gathering the information we need to properly assess those families in those situations. And then we also have, we currently have 2 hotline supervisors. We are hiring for a third because of the volume and because of the management of a 24/7 hotline. So we have supervisors who do that initial assessment and review for any immediate concerns that come through. This is kind of what our referral source is. And as you can tell, it's the top 4. The top 4 are all mandatory reporters, with no surprise to county staff that school staff are our #1 reporters. And that's been very consistent. You can see in 2020 when the pandemic hit, it took a huge nosedive. And that's primarily because the mandatory reporters that are making calls into our department are seeing kids on a day-to-day basis. They're our best eyes out to keep these kids safe. And so that's why you can see the schools, because they literally have 5 days a week contact with kids. Once we get reports, it goes through our red team. So we try and push all reports through our red team process, or and that's an acronym for Read, Evaluate, Direct. The primary goal is to determine whether or not the alleged maltreatment meets the statutory threshold for us to intervene and assess with a family. If so, then we determine the response time. So there's 3 different response times. We have immediate, or up to 8 hours, a 3 calendar day, or a 5 business day. We also then determine whether or not what track assignment. So Arapahoe County is a fully implemented differential response county. And so we have the opportunity to determine whether or not a family is considered high risk or needs more of a forensic approach or a traditional child welfare response approach, or if we can do an alternative. If this family or the allegations are presenting are low to moderate risk, could we do a family assessment response? And then if it doesn't meet criteria, we have a prevention program here in Arapahoe County. So then we then determine in this setting, if it doesn't meet criteria, could the family be benefit to our community development and prevention services? And just to talk a little bit about that, so our prevention program, again, the family does not, the allegations cannot meet the statutory threshold for abuse and neglect. We can't use prevention in lieu of assignment. And so we have 3 different areas of this prevention program that we work through. So the first one is the before bucket. And this is really where we're getting out, we're providing education, we're providing training to the community on how they can intervene before the allegations get to the point of an abuse and neglect allegation, how they can support families better. And then we do a lot of education on the roles of the department, because there are some misconceptions or thoughts that things that the department can do that we really don't have the ability to do. We then have the during bucket. So these are those referrals that are screened out, and but there's a resource, there's a barrier that we can help work with reporting parties or even families at times to remove that barrier so that they're not having to re-enter the department, or a referral doesn't come back in, or it doesn't get to the point where we would actually have to intervene. And then we have an after bucket, which we call post-closure outreach. And this bucket is really for those families who we were able to successfully mitigate safety and close out, either at an assessment phase or a traditional case or a permanency phase. And so we would get a new referral. The allegations don't meet criteria. We have one designated consultant who works with prior caseworkers to help families, again, remove barriers, mitigate concerns, so that they're not having to re-enter the system. So this is just kind of a quick purview of what our county's data was in 2022. So you can see we took just over 26,000 calls to our hotline. And of those, we took just over 13,000 referrals. You're going to ask me why there's that difference. And the difference is we are a fully functioning hotline. So again, we take not only child protection, but adult protection referrals. We take ones where reporting parties call back to check dispose. We have families call in and say, I need resources, I don't know what to do, or I need to get in contact with my caseworker. And so that's where that discrepancy is. And then of the 13,000, we assigned approximately 39%, which is pretty consistent across the state. And kind of a nice data point is, of those 39% or 5,174 referrals, we actually only transferred 6% to our permanency services, which means that we were able to mitigate safety in 94% of the assessments that we intervened with a family on. And then just again, some tidbits, we took over 3,000 adult protection referrals and assigned 565. And then we referred 1,180 to our community development and prevention services. And that is it.
Carrie, can I ask one clarifying question?
Yes.
When you do the referrals to the county partners, et cetera, what does that paperwork trail look like for a family?
Sure. So it stays in the referral. So we add notes of what we work with the family on in referral notes.
Okay. So I interact with this family 5 years down the road, and I know that they were at one point referred to partner services.
Correct. Yeah.
Okay. Carrie, thank you. That was super helpful. Appreciate you walking us through all the numbers piece. I'm excited to come back. So Hope and Carrie, appreciate that very specific county perspective. Going to switch over to our HCCC friends, if you will. Laura, I believe I got that right. Yep, Laura and Ron. Would love, just because I don't know members of the public that might be on the call and or folks that are kind of tuning in later, if you could give a little bit of context as to the HCCC, to the Hotline County Connection Center, and then kind of get into the nuts and bolts piece. We've got 15 minutes. We're right on time for y'all. So I'm going to hand it over to you, Ron and Laura.
Okay. Yeah, can you hear me okay?
I can. And Ron, if y'all could also both just introduce yourselves.
Yeah.
There you go.
Ron Trowbridge. I'm the manager of the hotline. I started with a hotline when it started, actually in 2014, but it officially rolled out in 2015. I've been with it ever since. I'm the manager. We have two supervisors, Laura and Anthony Cruz, right now, and of course Laura's with us. Right now we have 25 call takers. 2 of them are part-time, and then the others are full-time call takers, and we grow and add people on as either we've taken on more counties or as the call volume dictates, and we're able to do that. We contract right now with 56 counties, most of them full-time, and then some of them after hours to take their calls. And so our call volume, of course, as we've taken on other counties, has increased significantly. Last year we took, I think it was a little over 67,000 phone calls, and we wrote a little over 30,000 reports. We too, like Arapahoe, take not only child abuse and neglect reports, we also take adult protection reports. And that was something that honestly, it just happened because people are going to call those things in when they're, when you open up a hotline, they're going to be wanting to make adult protection reports too, or they're just going to be a part of maybe a child abuse or neglect report too. So we started taking those. Now it's a regular thing. I think last year we took something like 4,700 adult protection reports too. So that's part of it. That's growing every year. It grows fairly significantly. I think probably as word gets out and people understand that they can also make an adult protection report through the hotline. So our staff, obviously we're 24/7, we're open all the time. It doesn't make any difference what's going on. If there's a blizzard, somehow we have to stay open. No matter what happens, we'll stay open. So we have a many systems that we can fall back on if we need to, if the power goes out, if the internet goes out, whatever thing might happen to cause a problem. We've tried to develop a workaround for it so that we can continue to operate. And there have been many challenges throughout these almost 9 years now that have come up that we've had to find a workaround for, so that we can keep operating. Our people are scheduled throughout the day. Obviously, we want the most on when our peak times are, which is for us. Obviously, it's going to pick up throughout the day. It generally will have a sort of a little peak around 11 o'clock or so, and then drop off for lunch, and then it'll build up again till around 5 or 6 o'clock p.m. We'll have our peak amount of calls, and then drop off throughout the night. But we sometimes get quite a few calls even in the middle of the night. It depends on the circumstances. Law enforcement, when their swing shifts get off, will get a lot of calls because now they have time to make reports. School staff generally get out around 3:30 or so, and so that's when they're going to call in and make their reports. And so we staff our people as best we're able to manage those times. It's a struggle. I wish that we had time to provide more thorough training and uninterrupted training. That's not possible. We don't have the opportunity of having uninterrupted meetings or to be able to shut things down and all get together and discuss things. It's not possible. because we're always taking calls every single day, every single hour. And so we have to manage that, and it's very difficult. It's probably one of our biggest challenges is to try and find out a way of passing on information, of training people, helping them to become better as they get more experience and as time goes on while they're still working and while we're still taking calls and managing all of this. That's no question our biggest challenge there. Having said that, we understand that and we're happy to help out other counties. We often do. We get multiple requests every month, probably 50 or so requests every month from counties to take their calls for them so that they can have meetings, so that they can do training or whatever it is that they need to do. And we want to do that as much as we're possibly able. We want to be able to do that for them. And we do a lot of that here lately because the call volume has increased somewhat after we've come out of COVID and children are back in schools more often and mandatory reporters are seeing these children now. Of course, the call volume has picked up somewhat, and so it's harder for us to do that. But as much as we're possibly able, we'll take other counties for their meetings and their training sessions and cover them for a short periods of time, 2 hours generally. While they do that, we're happy to do that too. I guess that's we face the same challenges that I think probably everybody else faces around the country. Times have changed. It's difficult to keep people employed, to keep them working. They switch jobs on us often, and it's hard to get new people. Realistically, I think it takes about 1.5 years before somebody really gets the job down, before they really get to understand it and really get to understand the right questions to ask and why they're important to do that. So those employees become very valuable to us because now they finally got the experience. They finally understand how to do that. And for us, we have additional issues. We're taking calls for a lot of different counties. And they all have different needs. They all have different requests and different hours of operation and a variety of things. So it's very difficult it's a challenge for us to make sure that we get all of that right when we take their calls.
Ron, I'm gonna not to cut you off. I want to jump in a quick question before we move over to Laura for the second half and make sure we give her an opportunity. So a quick question for you is, you're talking about the tension with the training piece, both like, for your own professional development once someone is hired on. I just want to make sure that we're clear on what are the expectations of training for folks that are coming and staffing these roles that sounds like are hard to fill. Like what sort of training do they have? Because it sounds like once they're on, there's a lot of challenge to be able to like further grow them with the amount of calls, with the whatnot. So like what's the training that someone's coming with? Who are these folks?
Well, they're gonna get the mandatory training, of course, that the state requires. We'll certainly give them that. They will be with a call taker. They'll shadow that person. They'll listen to them. One of our training call takers, they'll be with them and listen to see how they handle their calls, and we'll slowly get them involved in the process themselves and be with them while they do that. We'll guide them for a period of about a month or more. And then they'll go to where they're taking calls themselves with somebody by them, to help them and guide them so they can easily get questions answered and that sort of thing for a period of time.
And I'm seeing Kathy's question. I think that's kind of what I'm getting at. Are there any requirements for field experience of any kind? I'm thinking of like Hope's reference of, and Yolanda, I'll come to you after this. Maybe you might have an answer on that, but I'm thinking of Hope's comment about like her experience with like assessment and being able to draw out those sorts of things. So I'm just kind of wondering like, what is that level of training? Yolanda, do you want to jump in and take that?
Yeah, if that's okay, Ron,
Yeah.
just because we go under state certification for hotline workers, right? So when the hotline became effective in January of 2015, there was an additional certification added into our Code of Colorado regulations, and I will make sure I can link that if people want to reference that information. It is the minimal education requirement is a high school diploma or equivalent to become certified as a hotline worker, and then there's a required fundamental course. So all child welfare caseworkers go through a fundamentals academy, which includes a lot of training, right, to then become certified in the state of Colorado as a social caseworker for child welfare. To become a certified hotline worker in the child welfare system in Colorado, there's a portion of those fundamental courses that are taken, our Hotline and Red Team course, and there's a course description I'm happy to share out as well. And so once the minimal education requirement is met and then the state provided through our child welfare training system, training is provided, and they do some what we call transfer of learning activities, so some on-the-job training. Then like Ron with his team, or Carrie at Arapahoe County trying to certify a hotline worker. I know their workers are most likely caseworkers. Anyone trying to certify as a hotline worker can then request to the state to be certified as a hotline worker. And then we would issue that certification. And that would then allow them to take those calls that come into the Hotline County Connection Center. And then annually to continue to be certified as a hotline worker, you have to have 10 hours of ongoing training. And that training here is between July 1st and June 30th of any given, it follows the state fiscal year. So there's not only the initial certification requirements for minimal education and going through the fundamental courses, there's also then the ongoing training that's required. So I just wanted to share that, and I'm happy to link more details about that information or answer any further questions.
Yeah, thanks, Yolanda. That's super helpful. I was like thinking of the different comments and so I just wanted to make sure that we were clear on that piece. I think I want to give Laura a chance to talk, and then let's open it up for questions to this portion. I don't want to miss the conversation we just heard before we kind of switch into the member panel. But Yolanda, I'd certainly welcome you to answer those questions for this portion too, because I know you have that context. Laura, let's come over to you for a little bit. And Ron, thank you so much. Sounds like you have been in this work since day one with the hotline. So just deep gratitude for the work you're doing out there. Laura, hello. Thank you for standing in for our sick friend, Anthony. Appreciate you being here. Would love for you to introduce yourself. And we've got about 5 to 7 minutes for you to kind of talk from your perspective, what you're doing, what's working, help folks understand really on the systems side.
No worries, I can do that. My name is Laura Hobden. I am a supervisor here at H3C. We sometimes get tripped up on the Hotline County Connection Center part. We answer the phone every day with that, and so we just shorten it when we need to. Like I said, I am a supervisor here. I've been a supervisor for almost 2 years. I've been a call taker. I was a call taker for 3 years before that. So if you can add that together, I've been here about 5.5 years. I have a unique perspective coming from a background of trauma. And so I do think about things a little bit differently than a lot of the call takers that don't come from that background. My point of view a lot of times is to kind of make sure that they're understanding what our purpose is and why it's important, versus just, this is how you take a call, this is the questions you ask. It's more of, why are these questions important? So that they know, if you have somebody that's talking about certain things, it's very important to use certain questions. You have to say words that are not something that a lot of people like to say, body parts, things about sexual abuse, things about drug abuse. And so I like to make sure that everybody's got the education to know that, I understand that sometimes these are things that are hard to talk about, but they are important for what we do. We do, like Ron said, do a lot of ongoing training. We try really hard to make sure we tailor that training to what we do specifically here, and to be able to make sure that everybody, like I said, understands why we do what we do here. I don't really necessarily have anything more than what Ron said. He's usually really good about being able to tell the story about the hotline pretty concisely and pretty well. He does it all the time. So we're very proud of the work that we do here, and you know, how important it is that what we do and then what all of the hotlines across the state do.
Thanks, Lauren. Thanks for jumping in last minute notice. I appreciate you sharing what you just shared. I'm going to pause us there. I would love to invite task force members with any questions you might have, clarifications, if you want to dig deeper a little on a little things. We have about 7 minutes before we need to switch over to the member panel. So would love for folks to come off. I know, Kathy, you had asked a question around, I see that in the chat, but folks are raising their hands. So never mind, Kathy, I'll come back to you later. Oh, you raised your hand, but you're fourth. Okay. So Chris, I'm going to go in line. Chris, go ahead.
So I just had a question of the calls that come in when they are not routed out to any services, or you deem them, I don't know, not credible or not necessary. Is there any contact with either the reporter that nothing happened, or anybody else, or even contact made with the family, like, hey, we got this report? Or is it just like thrown in a pile that dissolves somewhere?
I can speak for Arapahoe County. So just due to our call volume, we don't have the capacity to call every reporting party back, or even call every family to notify them. I can tell you from experience, when we do outreach families to either gather more information to make a decision or whatnot, usually the words child protection or human services it like they can't get past that, because they're like, oh my gosh, a report was filed, what's going on, you know, am I in trouble? And so we do provide the opportunity for reporting parties to call back if they leave their name to check the disposition. But other than that, we do screen it out in our statewide database, and it does sit there for any future reference, or we don't do anything else with it.
Thank you.
Kelsey, you're up. Kelsey, can't hear you. Sorry. We'll sort that out. I'm going to go to Kathy, and then we'll come back to you, Kelsey. Kathy, could you introduce yourself also, just so folks know?
Sure. Hi, everyone. I'm Kathy Wells. I'm a child abuse pediatrician and the director of the Kemp Center, and co-chair the committee with Stephanie. You know, I think a couple of things that I was just thinking of. Number one, I asked the question around field experience. So I was a part of the Child Welfare Action Committee, Stephanie, 15 years ago, plus years ago, that had made a recommendation for the statewide hotline, and was, you know, I come with this from a healthcare lens, right? So I think about this from like a 911 operator standpoint. And part of that came from my experience working in this field, and seeing, being in a position in my role as a clinician to see what was written and what was collected in the initial referral, and sometimes even talking with someone who is a mandatory reporter, like a physician, about what they thought they said, right? So there's a little bit of a phone game here, right? Where they might have thought they said something and they didn't, or it may have been that how it was heard at the time that it was taken down, or how it was recorded, was a little different than what they thought they said. And the reason that was important to me is because I know so much. So many early decisions happen based on what is collected in that first contact. And so coming with a lens of like a 911 operator or a nurse line, right? So someone in a nurse line setting really not only has an algorithm on which they follow, but they have a skill set, having been in the field, to be able to ask those additional questions, like I think Hope was referring to earlier, right? Like really like having that discernment to kind of ask those additional questions. And I guess in my experience, and I'm curious as to what child welfare experts say, is a lot of that comes from just having been in the field and having been in the work, right? And having been in the trenches to really get a sense of what those things are. I'm very appreciative that the strides that were made to really go to additional training, because I think when we made the recommendations, there wasn't really any training requirements for hotline workers. So I think that's a huge, huge, huge step in the right direction. So that's the first thing my thoughts were, and I'd be curious as to feedback. And then so the second thing was, I know that we also put into place a requirement for feedback to mandatory reporters, so that have an ongoing relationship with the child to the family. So if I'm a clinician or an educator and I make a referral and I don't know that dad is or is not supposed to show up with the kid at school or at the appointment, if I don't get any information back, I may not know that. But my understanding is that there are some limitations in actually delivering that requirement because it was an unfunded mandate. So while the counties, my understanding, are required to give some sort of feedback to mandatory reporters, there are some challenges in doing that because there isn't any funding that's specifically designed to do that. So I guess I would just be curious. And my understanding is it was feedback to mandatory reporters that have an ongoing relationship with that child in their professional role, right? So not that I'm a mandatory reporter and they're in my neighborhood, right? But that I professionally have an ongoing relationship. And so I guess those are two thoughts that I had listening to this really important conversation.
Trace, would it be okay if I answer those questions?
Yeah, please do. Please jump in.
Yeah, so I'm Michelle Dossey, and I'm the Child and Adult Protection Services Division Manager with Arapahoe County Human Services. A couple of things. One is that I can speak that we do value that our hotline caseworkers do have some field experience. That is why Arapahoe is unique in some respects, that we did require our caseworkers to be bachelor leveled. So they have to be qualified to do the work of a caseworker, but they are missing that 1 year of experience that the state requires. But a lot of our caseworkers are actually caseworkers who have come in out of the field and chosen not to do the work of being in the field because of the stress and the trauma of that work. So a good chunk of our staff are actually what I would call recovering caseworkers working on our hotline. And we do value that they have done the work and understand the questions that need to be asked and how to pull on some of those threads. And we value also giving our hotline caseworkers the opportunity to go to academy to become certified as caseworkers. So the majority of our caseworkers actually on our hotline are actually certified caseworkers, so that they get that insight and that knowledge and training. Specific to the Kathy, to the specified mandatory reporter portion of the law, which allows for those mandatory reporters, a special subsection of those reporters who have an ongoing relationship with the child and a need to know information in order to keep a child safe. So I'll just try to give context for the group. So an emergency room doctor is not a specified mandatory reporter because they don't have an ongoing relationship with the child and a need to know information, versus a teacher who sees a child every day, has an ongoing relationship, and potentially a need to know information in order to help keep them safe, are entitled to some additional information about the department's involvement within 90 days of making the referral. So they have to request the information. It's not automatically provided to them. They have to ask for that information. They first have to identify themselves as a reporting party who's mandated. Then they have to identify themselves as a specified mandatory reporter. We then send them a document. They certify or fill out a document about how they're specified and how they're going to use the information to keep a child safe. Then that information is transmitted back to our hotline. And once we then verify that they are all of those things and it does meet that threshold, then we expect our intake caseworkers, if they become involved, if it opens to an assessment, for the intake worker to make that contact with the reporting party, to follow up, to give them the information that they're entitled to know, and have that communication with them during that first 90 days of our involvement. If it's screened out, the reporting party can call back and find out. Carrie mentioned that we offer them to call back and find out what the disposition of the referral is, and they're entitled to, again, up to 90 days past the time the referral is made to gather that additional information. So that's that special subset. And although yes, it was an unfunded mandate, it is not about calling every reporting party back to give them the disposition when they're specified. That's not what the statute says. It just says that they're entitled to have it and can ask for the information. And then as a part of an assessment, when an intake caseworker is assigned, we want those caseworkers to reach back out to the reporting party, make sure that we have the correct and accurate information, that there's not any additional concerns or information that would help us, and then share with them during our involvement what that looks like. And then the final thing, Kathy, you mentioned was, I'm trying to remember there was another part of your question that you asked. So field training, specified mandatory reporting, and then there was another one.
I think that might have been it. I just, I'm curious if you felt, even though, so it's sort of above and beyond to have someone that has field experience. Have you found that to be beneficial? And number two, I just appreciate the clarification on the feedback piece. I guess I'm curious as to how well that's communicated. Is that always communicated to the reporting party that, because we hear a lot from healthcare persons, for example, we don't think that anything ever happens because we never hear back. And the implication is they don't know that they can call back. And so I guess I'm curious as to how is that consistently communicated, or is that a little bit dependent upon sort of the county, the hotline, those kinds of things?
I think it's dependent upon the county and the hotline. I mean, we train that in our mandatory reporter training that they're permitted to call back and find out the disposition of the referral that they made, as long as, again, they have to provide their identifying information to us. So you can't just say, I made an anonymous report, I want to find out what happened. They have to provide us their name and the referral ID number as sort of a passcode to protect that information that they're getting back. And I will tell you, as a hotline caseworker myself, who then went on to get my master's degree, then became a caseworker, and then for a period of time went back to work on the hotline, I value the experience that I had as an assessment or an intake caseworker to be able to draw upon the conversations that I had with reporting parties. I know that many other counties will disagree with me about this, but this was something that Arapahoe did, I think, again, unique to other counties, is that we required them to have, again, college education, the clinical skills. I value the hotline caseworker position so much. I think the clinical skills that they have to be able to tease through questions and pull on information, to act, I call it pulling on threads, to say, okay, you've said this, can you tell me more about that? I appreciate the clinical expertise that those positions hold, and that's why we chose to upgrade them to caseworker level positions. So again, I know that I want to make sure that not all 64 counties are going to agree with me on that.
Michelle, appreciate you jumping in and teasing that out. I know I'm hearing some other folks. I want to make sure we move through a couple questions, and then we'll have some more time at the end to kind of come back. Stephanie, I see your hand up, and then Jessica, I know you put it down, but I was going to call you back in if you're up for it. So Stephanie, go ahead. You're on mute, Stephanie.
There you go. My question is for Carrie and Michelle. You indicated in your presentation that you have, I think what I wrote down was sort of an after process or a post-closure outreach. Can you talk to us a little bit more about what that outreach looks like, and what is the receptivity? I always wonder if a family has been through a process, if you will, only to come to the end of the road where allegations were not substantiated. What is their amenability, if you will, to have services from an agency they know was looking at them?
So post-closure outreach, again, is a subset of our prevention program, but it was designed for families who end up back being re-reported to us, and either themselves need some booster services and supports, like what we set them up with maybe fell through, or they are struggling to get the services that we set them up with at the time we close them. They can always call back and ask for support, and that would go to a post-closure outreach consultant to partner with the previous caseworker to do that booster work. I will tell you, and I designed the program and set up the prevention program, and I'm very passionate about this, but a lot of reporting parties who call back and make multiple referrals, to Kathy's point, are unclear about what's happened. So we don't always do a great job when we're working with families at intake and permanency to make sure that the community partners are brought in and supported and are able to wrap themselves around families by the time we close out our involvement, so that they know what we're doing. They are clear about what the family needs, what we set them up with in terms of a support plan, things like that. And so a lot of the post-closure outreach work that we do is around calling back community partners to help them understand what we did during our assessment, where we left things during our assessment, what they can be doing to support the families. A lot of re-referrals after our involvement come from community partners who don't have that clarity and that insight. They didn't know the assessment closed. They didn't know what happened, or the family reappeared with other concerns. And so a lot of that is just drawing the connection for our caseworkers in intake and permanency. And so we have a staff member who works with those caseworkers to do better community partnership and engagement and outreach. That's what post-closure outreach means. Does that make sense, Stephanie? Okay.
Thanks so much, Michelle. Let's do one last question and then we're going to move on to our member panel. And I also want to note that like we're kind of, putting a pin, and you'll see this in the summary too, around what folks are wanting to go deeper on. I've seen a couple of notes. Don, I saw your note earlier around, hey, we might want to look into this. So we'll be tracking that as well. And if we don't have enough time to get to those things today, we'll certainly have time to revisit as you all see fit. Jessica, bring us home. One final question.
Thank you, Trace. My name's Jessica Daughter. I'm a sexual assault resource prosecutor with the Colorado District Attorneys Council. So I sit on the task force representing prosecuting attorneys, and I'm a mandatory reporter myself. Thank you all for your presentations. The question I think is pretty quick, but in understanding how the hotline system works in relation to some of the like materials we've reviewed and some of the ideas that we've had about how to improve our system. What I want to know and what I want to make sure I understand is the hotline really exists for data collection and to route to the right county and to make sure that every call is answered. It seems like those are some of the primary goals. And I'm not minimizing it. I'm just trying to identify the hotline kind of functions in that route, but it does not necessarily, screen appropriateness of calls. It's more black and white connecting with the appropriate counties and whatnot. Am I correct in that? Because I think the reason I asked the question is because of wondering, as we think through, are there ways to have kind of a separate assessment or something where DHS isn't necessarily notified because there's a determination of discretion that they don't need to be? I'm wondering, how it works. Does that make sense? Is it just black and white referring to DHS, or is there any sort of assessment done by the hotline beforehand?
Yeah, well, I can help with that. I think that the hotline does not use any discretion as far as screening the calls. Every single call is taken as a report. So, it may be something that may be screened out, certainly by a county for sure. But we're going to take it seriously. We're going to go through the whole process. We're going to get all the information that we can from them, no matter what their concern is. It doesn't make any difference. We're going to take it, even if it's a multiple thing, if it's the same thing, we just took 5 of those, the same report, we're going to take it again, just as if we've never taken it before. And we're going to get all the information we can from whoever's calling it in, and we're going to make the most complete report we can and send it on. And so it's not our responsibility whatsoever, as far as the hotline goes, to screen any calls or to make any determinations whatsoever on that. We'll take that call just as if it's the most important report that we have at the time and send it on.
Thanks, Ron. Yolanda, I'm going to pull you in for that too.
Yes, thank you. Thank you, Ron, for responding to that. I think it's also important to understand that that is done with intention, that the screening decision is done through either the red team process or a minimum of 2 certified caseworkers, one of which needs to be a supervisor to approve any screening decision, because we didn't want a decision being made in isolation at the point of hotline where one call taker is determining whether something is valid or not, credible or not by themselves. And so it's really meant to be a more dynamic decision-making process about what those next steps are. And so to that end, then when the calls coming into the hotline, whether that's at a county answering their own calls or at the Hotline County Connection Center providing call coverage services and a backup to all 64 counties so that no call goes unanswered. To that end, it was meant to not be an isolated decision-making process. So that screening process happens in sort of a next step after the hotline call is taken.
Yolanda, this might be obvious to folks, but I'm just wanting to clarify, when that goes on to the screener, right, where you said it's by design, are they just going off of the hotline intake information? Or are they Like what's
They're
what's-
going off a combination of information, right? So the hotline call taker, whether they're a certified social caseworker or a hotline worker certified, they're gathering that information. That's their primary function, is to gather the information, generate a referral if there's the concern or allegation of child abuse or neglect, and then it goes on to the next step of the decision making, whether that referral will be accepted for assessment and assigned to a social caseworker to then go out and make contact with the child and the family. In that process of the screening decision, they're looking at trails history. So to the point of like, well, what if quote unquote nothing happens? That still is a historical record. And so when counties are making screening decisions, they're looking at the history. So they're looking for patterns. If this is something that's been reported before, has the situation gotten better or worse based on this new caller's information that's been gathered? So history in our statewide database system, they're also potentially looking at criminal history. They're looking at Colorado courts to see if there's anything in there that might stand out as a concern or an increased worry or complicating factor. Some counties will also look at their benefits management system, so the Colorado benefits management system, to see, does the family have supports like getting TANF or food benefits or Medicaid, and things that could be a support and a resource to the family as well. So there are a few additional databases that may be accessed in the screening, the decision making at the screening. So there you have screening referred to as the hotline call taking information gathering process, and you also have screening that's referred to as the decision making process with what to do with that referral once it's received, whether it will be assigned for further assessment to a caseworker or referred to. Many counties have their own prevention services or some form of a prevention services, or if it will just remain as historical information in our statewide database system.
Appreciate it, Yolanda. Thanks for helping tease that out a little bit more. Just wanted to make sure we were clear, not making any assumptions there. Kathy, is this, I want to move us on to the member
Can I
panel.
just ask a quick clarifying question?
Yeah.
I hope
sure.
it's cool. And if we need to just table this and make it deeper.
No.
But
Questions.
I want to make sure I understand, so that I understand that the statewide hotline is really just gathering the information to getting it to the right place. However, what I think I also understand is that there is the possibility that that information that is gathered on that initial contact may be the information that the county then used to decide if it's screened in or screened out. And while the county may look at other pieces of information, they're not necessarily consistently recontacting the reporting party to gather additional information. Is that an accurate statement? I mean, that it would be up to the county to determine if they want to gather additional information, or if they feel that based on what they are hearing, it's enough to screen in or screen out. And so is that an accurate statement?
I would say, I don't know, Michelle or Carrie, other folks, if you would agree, I think that that's an accurate statement. I also think that, for counties, and maybe we do get into this in further conversation, they have to strike a balance, because when they're seeking additional information, we have to be clear that they're not opening an assessment, right? Like, because they haven't made that decision yet to accept something for assessment. So when you start down the path of doing an assessment for safety, you've accepted that referral for assessment. So sometimes that call back to the reporting party is really to get clarification on like a point within the narrative of the referral, to say, oh, I don't, this is confusing, or this, needs further explanation to understand a little bit more the context, so that the decision whether or not to assign it to a caseworker can be made. If what they're doing when they call back the reporting party is to start to ask the reporting party questions that are part of like what would be an assessment information gathering, that's where counties, I think, have to really be mindful to strike the right balance, because we have seen situations where you see multiple notes in a referral and it's like, well, they were basically starting an assessment, so they should have done the components of a complete assessment. They're, starting to call other people to, understand more the dynamics of the family. So I think, just to answer your question, yes, I think that would be an accurate statement. And I did just want to clarify, in case this wasn't clear in what Ron and Laura were saying. So the Hotline County Connection Center, in their call taking duties and services, they will never make a screening decision. That's at the discretion of the 64 counties. So they will, as Ron said, gather all the information, no matter who's calling or why they're calling. They will forward and pass that along to the county, and then the county will make that next step to screening, that next step decision for screening it in, what we call screening it in, which is accepting it and assigning it, it or screening it out, which could be referring to prevention services. So I just wanted to highlight or clarify or reemphasize that point, because sometimes when a caller's calling, they don't know necessarily who they're speaking to. They don't know if they're speaking to the state hotline, if they're speaking to Arapahoe County, if they're speaking to Mesa County, and they're just reporting the information. So I just want to be clear, the Hotline County Connection Center doesn't make any next step to screening decisions.
Thanks, Yolanda. And you're not finished. We're going to bring you on to the next portion too. So, so hang tight. Kathy, appreciate that question. TBD on if it was a quick one, but we'll give it to you. I'm going to, so a lot of gratitude. Thank you so much to Carrie and to Hope and to Ron and to Laura. Really appreciate your thoughtful presentations and willingness to hang in there with us and answer some questions. If y'all are all able to hang on, we'll do a member panel now with 3 folks from the task force themselves, and then we'll kind of open it back up to have continued conversation. I'm not seeing any members of the public requesting public comment, so we will go to the full hour unless I see any requests. Just a heads up to folks. So Doris, with that, we're going to bring our friends Michelle and Yolanda back in, and then I know we're going to add Nicci as well. So Doris, would love to hand it over to you.
Awesome. Thank you, Trace. So I think that this is a really good transition point in diving a little bit deeper into what on the ground have folks seen and experienced with respect to what happens once reports get made, and bringing in a little bit of process and outcomes together, or process and impact together. Thank you, the 3 of you. We've heard a lot from you, Yolanda and Michelle, I think, to help inform that process piece, but also in the conversation, I think you surfaced a lot of the nuance that bleeds into impact as well. And so I want to dive deeper into those components. Before we do that, would love to have the 3 of you just quickly reintroduce yourselves. You had a lot of airtime during the prior section, but I don't think we had you introduce yourselves at that point. So would love to have the 3 of you introduce yourselves. I'll start with you, Nicci, and then we'll do a round robin before we dive into some questions.
Sounds great. Thanks, Doris. So I'm Nicci Surad. I work with Mesa County. I've been here for a little over 15 years. I started out as a placement resource manager, so licensing and monitoring foster homes and kinship homes. Then I moved over to investigation, traditional investigation or assessment, as we call it here. I did that for about 3.5 years. I loved Michelle's recovering caseworker statement. That was amazing. So yes, I struggled 3.5 years in day-to-day investigation is very traumatic. And so I did move over to the hotline team. And I was in the seat for 5 years. And as Hope talked about it, we're assessment workers as well. So I did many fatality assessments, egregious, near fatals, not egregious because that hadn't necessarily been developed at the time, but near fatals and fatal assessments, institutional assessments. And then in 2018, the supervisor position for the team came up, and applied for it and was granted that position. And so I've been supervising the team now for 5 years. And so that is my background in a nutshell.
Awesome. Thank you. We'll go to you, Michelle.
Hi, Michelle Dossey again. I'm the Child and Adult Protection Services Division Manager for Arapahoe County, so I oversee that entire division. I've been with Arapahoe County for almost 29 years. I have held a variety of roles, from hotline caseworker, hotline supervisor, intake worker, intake administrator. I developed our community development prevention program and worked that for about 4 years, and then I have been the division manager now for about 2.5 years. So I also teach part-time at Metro and the University of Denver in the Graduate Schools of Social Work, as well as I'm a contract worker for the Child Welfare Training System, and I teach 2 classes to supervisors there as well.
So as I wonder when you sleep, and also beg the question of whether I'm doing enough in my own life, you're doing a whole lot, Michelle. Thank you for that. Yolanda.
I had that same question. I'm like, wow, I am an underachiever.
100%.
Hi, everyone. So I'm Yolanda Arredondo, and I serve as the Deputy Director for the state's Division of Child Welfare. I've been in that role about 2 years, almost 2 years. I've been with the state Division of Child Welfare for almost 8 years. And prior to that, I worked at Denver Human Services and was a hotline worker, a caseworker, a hotline supervisor, and intake administrator there. So was there for 8 years. So that's me in a nutshell, my child welfare experience.
Awesome. Thank you. Thank you all for agreeing to participate on the panel today. I think it is a nice opportunity to dive deeper, moving again beyond the process piece and talking a little bit more about impact. And I want to start with just digging a little bit deeper into the confusion component with mandatory reporters. So we know that, reporters come, they want to help. All of you indicated that most of the reports that you receive, somewhere around 3/4, it looks like, for all of you, in either informally, anecdotally, or more officially in your data, that about 3/4 of the reports that you have coming in are coming in from mandatory reporters with this desire to help, but also you all named in some way this concept of wanting to help, but then also some confusion about what child abuse and neglect is, and whether or not it seems like reporting to the hotline is the necessarily the right vehicle or only vehicle for intervening. Michelle, I want to start with you in large part because in your survey, you talked about your prevention program. And I know in the segment really talking about the process piece, we heard a little bit about your prevention program, but would love to hear more about what that program looks like and how that can be leveraged as a way of potentially shifting some of the report volume that we get to that's currently going to the hotline, but directed to more prevention work.
Mm-hmm. So in 2018, just leveraging the 23 years or so at that point and working in intake, I know that our community partners were struggling to support families and needed help and guidance in doing so. And they often didn't understand our system, were confused by our system, and they genuinely want to help families, but just didn't know where to turn to, and also struggle with wanting families to comply with the social norms, right? To get their kids to school, to get their kids fed, to get them clothed, right? And to make sure that they're parented in the best way possible. We want that for all of our kids, to have all the things, right? But those oftentimes the referrals that we receive, primarily from our school districts, and in Arapahoe County, for context, we have 9 school districts, do not have the resources and the capacity and the bandwidth to fully help families in the way that they want to help families, and don't always have the resources necessary to do so, and oftentimes misperceive concerns for families as a child protection issue. And so we would see them making reports that don't meet the statutory threshold of abuse or neglect, or they were confused by it and just trying to fit it in. And they would default to us to say, go out and check on the family, go out and help the family, go out and see what's going on for them and see if there's something, I'm worried about them. Just lots and lots of worry. And, I spend a lot of time talking to teachers who had kids in the classroom and couldn't put the pieces of the puzzle together. They knew that something was wrong, but they just weren't sure what it was. Sometimes they were sure. Sometimes it was clear and kids came in with injuries or made disclosures of sexual abuse or things like that. But for a lot of our calls, it wasn't that. And so I created the prevention program with the primary driving focus to be not us providing services to families, but to coach them to help families, to have hard conversations, to ask questions, to not make assumptions about families, to get curious and to be honest with families about what they're worried about, and then to ask them what they needed, because families are the experts on themselves. They're not the experts. And so what is it that you need? How can we help you? It seems like your child might be struggling. Here's what I'm seeing in the classroom. What are you seeing at home? And I think, I've taught mandatory reporting trainings for, almost the entirety of the time I've been with the county. So I've been in front of a lot of community partners, and they, again, they don't always know how to have hard conversations with families, to just be transparent with them. And so the program was designed to help them understand how they could engage with families, how to ask hard questions. So can I just give you one quick example? I had a middle school counselor call our hotline once and say that he intercepted a kiddo in the hallway who was tired and was struggling to stay awake in class. And so he was talking with the student about what was going on. And the student said, hey, my mom left a domestic violence relationship. We're couch surfing. I don't have a bed. I'm tired. He didn't say it in this way. I'm summarizing, but he essentially said that he was worried about his family and they didn't have what they needed. So he called and made a report to us and said, we want you to go out and investigate, make sure there's no domestic violence, make sure there's nothing going on. And we said, hey, it doesn't meet the statutory threshold. The domestic violence was in the past. Mom has moved on. She just needs help and resources. It sounds like, why don't you call her and ask her what you could do to help her? Tell her that you intercepted her child in the hallway, that you're worried and concerned, and what is she seeing and what does she need? He didn't want to do that. He felt like it was our job. He's like, that's not my job. My job is to educate kids. Your job is to serve families. And I said, I disagree with you. Why don't you call mom? And this took us hours, I got to be honest with you, of coaching and guidance to say, why don't you call mom and just ask what she needs and how she's doing? This mom said, you know what, actually, I do need a lot of help. I need help with housing. I need help with trauma therapy for my child. We're struggling. This has been a hard run for us. We need help with employment, food, all the things. So he's like, I don't have those resources. And I said, well, guess what? I have the resources. So draw a connection between us and we'll partner together to support the family, to get them what they need. That's the primary focus of our community development prevention program, is to enhance the community partners' capacity to serve families without making us the default system to do so.
So to access that kind of intervention, does a report have to be made to the hotline?
Well, here's the struggle that I had. In theory, no. But sometimes our reporting parties do have concerns for abuse or neglect. So we teach them as a part of our mandatory reporter training, but we also have a community engagement training, that they can call the hotline and ask for what they need, which is often prevention services. So you don't have to make it abuse or neglect. You can call and say, I need prevention services. That's a mechanism, though, for us to keep track of and have documentation of the work that we do to support families. So it gets screened out when it doesn't meet the threshold. It gets screened out to prevention, but stays as a screened out referral. And then we enter all of the notes and information, the resources, the referrals, all of that into the referral notes. Carrie mentioned that, to document that. And it's a mechanism for us to make sure that what's being reported when they're requesting prevention services, that it also doesn't meet the threshold. Because sometimes people say, I don't want them to be involved. They didn't mean to hit their child, but they left an injury. And we have to say, I'm sorry, that meets the statutory threshold. So that's how we have it structured, but they don't have to do it that way.
Okay, thank you. Thank you for that.
Yeah.
Nicci, you mentioned something in your survey about, sometimes mandatory reporters who, want families to get services and supports that they need. They know that it's really not abuse or neglect, but the family may not be seeking out those services. So this ability to kind of force families to engage in services is something that you surface. And so I just want to hear from you as you think about the prevention program that Michelle talked about and your concerns and what you lifted up in terms of forcing families, how an intervention like this might play out in Mesa County.
The intervention that Michelle's talking about.
Yeah.
We have a prevention program in-house in Mesa County as well. It is designed to serve the families. So it's very interesting to hear that process that Michelle has and Arapahoe County has about, building the community up to support the families. I think that's something that we haven't thought about. Our prevention services are completely voluntary. So we do have a process. The prevention referrals have to come through our hotline as well. It started out as their own hotline to request services, and then it turned into, we are possibly missing actual abuse or neglect referrals, and so it transitioned over to our hotline as well. So if they start out saying, I'm interested in prevention services, or family empowerment is what we call it here, if they do say anything like, she didn't mean to hit her child, it left an injury, we do transition into that referral. And so going back to kind of the forced conversation, I guess, we screen out that referral, we reach out to the family and say, we hear you're in need of services, we'd like to help you. How can we help you? There is a lot of turning us away. I think Carrie mentioned it as well, that you hear DHS. We never say child protection when we call them. We say Department of Human Services, but people tie them together, right? And they're like, no, thank you. I don't want to be involved with you. So I think that there are some nuances of prevention services are that they are prevention to hopefully prevent further circumstances which could result in abuse or neglect. And I think that's where the community struggles, is they're seeing this family struggle and they're not, they're either unable or unwilling to change their circumstances, and those circumstances will result in abuse or neglect if not worked on. And so kind of the situation that Michelle was talking about, absolutely that family needed resources. And if they weren't receiving any resources or unable to receive resources, it is reasonable to say that that child would eventually not have his needs met and be unsafe. And so having, the community is seeing this and kind of seeing the patterns and seeing things happening, and they're like, we're reaching out to the family, we're offering these services, and the family is saying no. We and DHS are reaching out and asking to help them in the prevention arena, and they're saying no. And so I think there's frustration around that. And also these families have the right to parent the way they want and go about their lives the way they want until it meets that threshold, right? And so I talked about it in my survey as well. I mean, it does come from a good place. I do think there are biases that come in as well, but it does come from a positive intent place of, I see this family struggling and I'm worried of what would happen, or what could happen, and what can reasonably be foreseen to happen if this continues and the family is just not willing to participate or unable. There's also inability to participate for lots of different reasons.
Also, I want to come back to you, Michelle, and then I have another question that I want to bring to you, Yolanda. I want to come back to you in terms of in operation. What have you seen in terms of impact with this approach of emboldening, in a way, community systems to better support, to intervene and better support families that have needs that are not truly issues of abuse or neglect that require a child welfare intervention? Has this proven successful, and what kind of impact have you seen?
Yeah, I would say largely it's been successful. I think our community partners have appreciated having a team of people that they can reach out to ask questions and get information from and share resources from. The whole hope is to reduce the number of referrals that don't meet the threshold, and that they start to learn sort of that trickle-down effect to serve families differently without defaulting to us. And some of our school districts who are super involved with families have said, these are things we've already tried and we've hit a wall and we've not been able to impact the change. And so, there's lots of conversations about when does it reach the threshold for us to become involved and when does it not? And a lot of times we have to say it doesn't, and they have a right not to utilize the resources, and they have a right to parent, as Nicci said, in the way that they see fit. And so a lot of, I think, just trying to straighten out their perspectives about that, a lot of conversations to straighten out their perspectives about that and to see families differently. We do a lot of, the program was really, I created it after I met Dr. Amelia Frankmeyer, who really talked about seeing families, seeing yourselves in families, and trying. And I think the pandemic ended up helping me in a way, because we all experienced the pandemic, right? About how do you see yourselves in the families that you serve, and how do you see yourselves as all one referral away from being a child welfare family? I think that's been a huge impact, and have been able to draw some attention to community partners to really think about themselves, if they were in this, how they would want to be treated, how they would want to be seen. And I think that there's much more work to do with that. And I've shared with the community multiple times my perspective of having a child with a mental health diagnosis and trying to navigate the school district and the mental health professionals and the medical professionals and getting them all on the same page is really exhausting and overwhelming. And I'm hoping that we can continue to make an impact and change that. Data wise, I would tell you, we're seeing decreased referrals. We're seeing better outcomes for families who are being served in this model than those who are not served. So we've been able to take side by side looking at the data of those who got prevention versus those who did not get prevention, and seeing that those who got it had less recidivism back into the department. It's early, and some of that data is hard to really prove that it is tied to the community development prevention program that we have, but it's been successful from my perspective.
Thank you. Thank you. One of the things that you reminded us of is the pandemic, and this opportunity to potentially see families differently. One of the things that we saw out of the pandemic was that there was a decrease in reports to hotlines across the country, and we didn't see an increase in child fatalities or serious harm during that time as well. And I want to come to you, Yolanda, in one of the things that you named in your survey was that there was this decline in hotline reports or referrals during the hotline. You called it a cliff. And so I'd love to hear if coming out of the pandemic, if there is anything that you're thinking about differently in terms of how the system is currently structured today and what opportunities might be presented as a result of what we've seen in terms of the data, particularly as to mandatory reporters since the hotline.
I think during the pandemic, one of the things I remember sort of hearing, listening to NPR, was this idea of, going through a global pandemic. Oh, sorry. I don't know if somebody said something. Everyone had moments of struggle, right? Some more than others. And that was a unique experience. Whereas I think sometimes, mandatory reporters may see the families that they're reporting because they're concerned, or they have, either observed or had something disclosed to them that's suspicious for abuse or neglect. And as everyone's mentioned multiple times throughout these meetings, a lot of the intention is about just the worry. Michelle said that, right? Worry, worry, worry. I want to see this family get help. I want to see them be resourced and be able to address those issues. And this is one of the means that, people are required to or believe that is going to get that help for families. With the pandemic, sort of going back to that, what I was listening to is this idea of like this shared struggle that we were all going through, and stresses and experiences that were new for some people, maybe familiar to others, just about isolation and needing grace, needing support, needing sometimes mental health support, all of the above. I think that really lent itself, I can say, speaking for myself as a mandatory reporter, and just knowing that, the times that I had struggle, I think it made me more sympathetic and empathetic as a professional to everyone that I interact with, because there was this shared struggle. And that can sometimes be different than maybe pre-pandemic experiences of like, here's the professional, here's the mandatory reporter, here's the family or the client, and then there's this legal obligation to make a report if they know or suspect child abuse or neglect. And that that definitely has an impact on rapport, on trust, on relationship building, all of the above. So I think the pandemic really lent itself to maybe more sympathetic, empathetic, and giving grace to ourselves and to each other. That cliff was really what we saw as a state was because, our top 3 mandatory reporters were no longer having that in-person regular contact with children and youth, right? Or at least the top 2 in particular, school staff and medical professionals. So that was the cliff effect. What we did see is a small uptick in more reports as a state from neighbors, family, and friends, because they were then the ones who were going to see those kids more often, right? Because kids were schooling from home, people were home from work. Some people were, some people didn't have that opportunity or choice. So the idea of like who was having eyes on children and then still having those same concerns and worries, because I will also share that I think with mandatory reporters really having this core desire to see families resourced and supported, more than punished or held accountable, so do families and friends and neighbors even, right? That's often why they're calling too, because they don't know what else to do. Maybe they have or haven't talked about their concerns with the parents. Maybe they, have, or maybe they assume something. Maybe, we don't know all of what drives or motivates everyone when they're reporting. It's just this idea of, for the most part, in all of my years of experience in child welfare, people are wanting to see families get support and help and resources. And I think that, kind of to wrap up, sorry, I know I've sort of gone on a stream of consciousness, so I appreciate y'all's patience with my response. I think one of the things coming out of the pandemic is some of the conversations that we maybe didn't have as communities or as a country, even some reckoning around disproportionality, disparities. What I've appreciated, even now that we're still in recovery from the pandemic, is that those conversations have not gone away. And there's been in Colorado, even like legislative attention, right, paid to those questions about families' involvement, and that we do need a child welfare system as a safety net for families. However, it shouldn't be the number one go-to for how families get support, because it's not the prevention services. Yes, those are meant to be support and resources. Child welfare as a system, child protection rather, as a system is meant to intervene because there's a safety concern, and trying to figure out what's then the right balance to strike so that there are enough prevention, early intervention, support, and resources in communities so that families don't have to get reported to the child protection system before they can see that help.
I loved your stream of consciousness, Yolanda. There was a lot of nuggets in there. I want to all of you named this both tension, I think, lack of understanding around mandatory reporters and mandatory reporting, and what is neglect, and which is a big category, and even physical abuse. Like what is abuse and neglect? When should you make the report? What should you provide in a report? Have named some of the challenges with reporting, and have talked about opportunities to provide better education for mandatory reporters, and I think the community writ large. But want to just do a round robin on, and this is a theme that we've talked about as a task force before, about an opportunity that could come out of in terms of the recommendations. But I want to do a round robin on what would be some of the like topical areas or priorities that you would want to have included in mandatory reporter training consistently across the state. We'll start with you, Michelle, since you came off mute, quick and in a hurry.
We definitely need more clarity. They need more clarity around what are the definitions, and they need tangible examples and context. So a good portion, probably 30 minutes of the training that we do, walks through the actual, what is physical abuse? Like, you have a right in this state to spank your kids, including them with an object, as long as you don't leave an injury, right? Neglect is where we spend the majority of our time, where we get the most questions on, because they don't understand the definitions. The other component, which is why we have continued to provide the training and not default to what the state offers as a training, is because people want to understand what the child welfare system does after they after they make a report. What will happen? How do you make decisions? What is a red team? What counties not all counties practice DR. So they want to know what counties practice DR. They want to understand what DR, what's the difference? They want to know the timeframes of what happens during an investigation, what happens in a permanency case, what happens with court, how do we make decisions to remove kids? And they want to just better understand the child welfare system, about what we can and what we cannot do, because that's how we, I think, from my perspective, also minimize the number of reports that don't meet the threshold of abuse and neglect, because they have unreasonable expectations for what the department should be doing. So that's where we spend a lot of time. And I don't think that the training that is the standardized training offers that perspective.
Awesome. Thank you. Nicci?
Yeah, I agree with a lot of what Michelle said. I think it is really that understanding of what we can and can't do. When I go to present, we also have mandatory reporter trainings that we present to our community as well. It is also a voluntary thing. We will offer it, and they can choose not to take it or not, or they can come to us. But I often will start that with, I'm not here to not only tell you what we can do, but what we can't do. There are a lot of people that say, you know, I'm not going to call DHS anymore because what's the point? They're not doing anything anyways. And I think that could lead to some child safety concerns, right? They may have some true actual abuse or neglect concerns that they're not calling in because the last 3 referrals that they called in got screened out. And so really helping our community understand what we can and can't do. And the tangible examples is really important. The neglect piece, I do think, is one of the biggest struggles, even from county to county. The neglect statute or the neglect law is so very subjective and vague. And, you know, I don't know if we will have the opportunity to address that in this task force, but I think it does need to be talked about because it can be very easily confused with poverty and other, you know, need for resources. But you know, when we do our mandatory reporter trainings, we always end with, if you're in doubt, call in the report and let us decide what to do. And I don't, you know, is that problematic or not? I don't know. You know, there's many examples of times when, you know, I put this in my survey where somebody hasn't called because they don't understand the rule. And then you know, that something serious happens to the child. You know, we had a case where there was a 17-year-old mom and she was working with a provider. So she's seeking services, she's doing things. And, you know, she was going to become homeless because her family had kicked her out. And so they're calling regarding the 17-year-old being homeless, which, you know, is definitely something that, you know, may need to be called in to us because there's that impossible neglect situation with the parents not providing for the 17-year-old. 17-year-old also had a baby and you know, randomly said, oh, and, you know, I saw some bruises on the baby. You know, we were able to kind of assess that during our phone call, ask those deep questions. And ultimately it turned out to be an egregious case. This baby probably would have died. And had that misunderstanding from that referral source of the concern of a non-mobile baby having injuries, had the 17-year-old mom not been struggling with needing resources, they would not have called our hotline and that baby probably would have died. The baby had multiple internal injuries. And only a few minor bruises on the outside. So I hesitate to turn into the system of you don't call in things because I do worry about those actual child safety things being missed. And so I don't have an answer to it right now, but I do wonder, what does it look like to really get our communities trained on what is abuse or neglect, and all those little nuances, right? Of the 17-year-old needs resources, but the baby needs a report. And so how do we bridge that gap and how do we train them? But I think that is the most important part that we need to do.
Awesome. Thank you, Nicci. Yolanda?
Yes, thank you. So I was also seeing a question in the chat regarding like how bias essentially is woven into the training. So it definitely is spoken about or referred to in the hotline and red team training that everyone who needs to take hotline calls has to go through. I think we can probably do even a better job of being more explicit when we're talking about confirmation bias, when we're talking about you know, our own personal experiences as a child and a youth, right? And how that sets us up for, or as a parent, how that sets us up for expectations about what we think other families should or shouldn't be doing. So in the question with both Nicci and Michelle mentioning what is it that child welfare or child protection can do and what we can't do, I would echo that as some. It's so nuanced though that it's really hard to get across in like the 2-hour online mandatory reporter training. There's efforts toward that, and it's nuanced to really dig in and talk with people about what does it mean to have an expectation based on your cultural experience, your historical experience, again as a child, a youth, and now even as a parent, to be able to then say, how do I try to be more objective in how I'm trying to look at a situation and saying, do I truly suspect child abuse or neglect and therefore need to make a report? Or am I just worried about this family and want to see them get support and resources? Or am I coming across, are they triggering something in me that's like, well, I think every family needs, I'll say this in mandatory reporter trainings I do, I may come across as saying, I think every child deserves a house with a front yard and their own bedroom and, you know, a place to play and, you know, 3 well-balanced meals a day. Like that can be my bias. And so anything that comes across that is not fitting in that box for me I can then perceive or filter through a sense of worry. And so how do we help mandatory reporters really have a moment of self-reflection to say, am I suspecting abuse or neglect and why? Am I really worried about this family because I think that they could benefit from support and resources, and I don't really think this is abuse? Or maybe, as Nicci said, it's very vague around the neglect because it may be poverty related or resource deficit related. Or am I just thinking that this kid deserves better than what they're getting right now, and I'm not really on board with how this parent approaches parenting because it's not the way I approach parenting, right? And that's my own bias. So it's really, I think, can be nuanced and complicated to help mandatory reporters have that self-reflection when the law really is, when you suspect, and whatever it is that makes you suspect, you need to call.
Awesome. Thank you, Yolanda. That's one of the things that I really liked about the approach that that Michelle is taking in Arapahoe County is this opportunity to really consult with mandatory reporters around you know, what the situation is and to what extent what they're talking about is something other than abuse or neglect that mandates a report and where another intervention might be possible. I want to open the floor up. We have about 11 minutes remaining. Trace, you haven't signaled that we've gotten any opportunities for folks to provide public comment. So want to provide opportunities for folks to come off mute and ask questions out loud, and also been tracking what's in the chat. So lots of recommendations around things that we could and should be looking at. You know, underscoring this idea around what might be an individual's cultural or personal preference for parenting, and whether or not parenting choices or differences among parenting may in fact be abuse or neglect, and opportunities to provide training that is more than one time, and so that there's ongoing training opportunities. So would love for folks to, if you wish to raise your hand, so we can get your voice in the room and into the conversation. Yeah, we're real chatty in this little chat box.
I was gonna say, can we get Donna to give some voice to her comments in the chat? Donna, if you're willing, before.
I have so many thoughts, right? And the thing that I'm trying to be mindful of is sticking to this conversation around mandated reporting, right? Because it takes me through a whole nother lens, right? Around parenting and classes and mandating things. So moving from mandates and really having families have access to things that really increase and improve their parental capacity. So, you know, I think about, you know, parenting classes and some of the things that I did back in the day when I was at a county level and sending people to stuff and checking off the checkbox for compliance sake, right? Yes, they did it. But then we get these families coming back, and checkbox stuff doesn't reduce recidivism, but making sure that people really get what they need, right? The difference between equality and equity, giving people what they need in order to be safe and prudent parents. So we can't tell level 1 families, like, we're going to send you to this parenting class and timeout is the intervention. And there's a use of a timeout chair and families don't even have a kitchen table to sit at. Like, that doesn't make logical sense. So just thinking through that. But in terms of some of the stuff that I put in the chat, like, I do think we have to move away from that lens of thinking that we're here to provide surveillance to families, right? Like, as people were talking about the impact of COVID and, you know, teachers not having eyes on kids. And I'm like, is that really a teacher's job to have eyes on children? Or is it their job to educate our children? So I think, you know, just like structurally, like, we have to redefine and reframe what we really think human services is about and how we interact with families. So if we're servants and helpers, that's a different lens than watching and catching, right? And so, yeah, I'll just stop there.
Thank you. There was a lot in that. When I think about mandatory reporters, the notion of mandatory reporters reinforces that role of watching and catching, right? So that's the thing that's bubbling up for me. And one of the challenges with being able to intervene with CPS being able to intervene and provide services and supports is the barrier that is necessarily created when you're investigating or assessing for a thing done wrong, and then coming on the back end and saying, well, we really want to support you. And so Chris put in the chat this question about rebranding CPS or DHS as a more of a support, given the duality of the roles that the agency necessarily plays. So if any folks have any thoughts or reflections about the ability to serve in those dual capacities and being able to be seen as a really a supporter of families and providing services to keep families intact when part of their role is also investigating and all of the potential negative consequences that come from that relationship.
I think some of the conversation, and we go through this in the academy. It's been a long time since I went through Caseworker Academy, but in conversations with newer caseworkers, that is what is being taught. That is, we're teaching to engage with families, not be punitive. How can I help you? I think we're working towards rebranding. And I would love that. I would love for me to be able to show up at someone's door and say I'm with, child welfare, and they say, oh, great, I need some help. That would be amazing. What happens in practice, though, is very, very different than what we would like to see. I can show up to that door with that family with being as engaging as possible. And if they want to shut the door in my face, and there are child safety concerns or child abuse or neglect concerns, it's very, very difficult to do that, and to be engaging. And so I think that there is a lot of conversation about kind of the pie in the sky best practice, and how does that really show up in the field when we're doing the work with families. If we could rebrand, that would be amazing. And I think that when we have, and we will always have, because there will always be child safety issues, but when we have that power or authority to remove your children, it is very difficult to get out of that mindset and have the community view us as helpers, when the vast majority of the time we want to. I think it was Carrie who did some data in Arapahoe County. We only remove on 5% of our assessments. Like, that is not what we're here to do, but the community sees it as all DHS does is come and remove your kids. So don't talk to them, don't work with them, because they're just going to take your kids. And, I think Michelle talked about it in her survey as well, of, the no-win situation of we get involved too much. And then when something bad happens, we're not involved. And so, yeah, that's what I have to say.
Awesome. Thank you. Kelsey, I know that you had a question. All right, we'll come back to you, Kelsey. Jade, I see your hand up.
Thanks, Doris. I just wanted to speak a minute. Sorry, I'm on here twice, apparently. To the question that was just asked about kind of rebranding child welfare. And I have lots and lots of thoughts and opinions on this from a kind of child abuse prevention perspective. But I think, really echoing what Nicci said, I feel like the fear that just gets kind of embedded for families around family separation will make it really hard for child welfare to be the one who can build that really vulnerable relationship with families where they are able to speak about the true kind of needs of their family, because that fear is just paralyzing. And so, I think there's a lot that we could talk about here around how how child welfare and communities and child protection and prevention programs work together. But I do think that that dual role is complicated and is part of how we've kind of gotten to this position where we are having meetings and conversations like this, because child welfare doesn't feel like a place where I'm necessarily going to get support. I understand for families that are involved, there is a lot of support. I understand that families provide, or that child welfare or child protection provides a lot of support to families. I just don't think that's the community perspective. And I think that at some point, acknowledging that and stopping to try and make child welfare feel like it's supportive might be something we should really be considering.
Awesome, thank you. And I think a lot of that is about about the community taking on the role of rebranding because their experience with the agency is different, more than the agency saying, oh no, we really are a different thing, right? You know, because that experience from folks who interact with the agency is I think what gets perpetuated in terms of the experience. Thank you to our wonderful panel members who are amazing, as you have heard today, partners in this task force, Yolanda, Michelle, and Nicci, and also for the discourse that we had offline in the chat that I think is helping us to reinforce and dive deeper into these areas that we will strategize around. Training, looks like refinement potentially of neglect definition, alternative paths for families that do not necessarily mean reporting to child abuse and child abuse and neglect hotline. So and also, you know, just learning more about what that process looks like, I think has also been really informative in helping us to, as we continue to peel back the layers of the onion and arrive at thoughtful recommendations. I think I'm turning it back to you, Trace.
Thanks, Doris, and thanks all. We've got 1 minute. I'm going to do 2 quick things. I'm dropping in an exit survey. Again, we always really appreciate your thoughts, ideas, feedback. So please take a few minutes just to complete that for us. Very helpful. And the second thing is, we're back in just a couple of weeks on October 4th. So we took a hiatus, and now we're kind of digging back in. Between now and October 4th, you're going to see a lot of invites for meetings in 2024. Looking at the syllabus and the work that we all have to do, unfortunately, you are all stuck with us monthly again in 2024 because we have lots of work to do, and you all are doing excellent work. So excited to move things along with you, but we do need to continue with these meetings being every month. And so you'll see those invites coming across for 2024. Any last minute questions, Stephanie, anything to add? Or Kathy from your end before we send folks on their way? Okay. All right. Well, thank you all. We'll see you back on October 4th. Thanks so much.